Police in a South African township. People run. They know they shouldn't be out, and they know the consequences can be harsh. The lockdown rules here are among the strictest in the world, and security forces are accused of using excessive force. Several people have been shot. This young woman is so scared she wants to remain anonymous. She says police beat her up with sticks after finding her walking along the sidewalk.
It's actually traumatizing because I've never been beaten up like that. I've never. I was in pain like for 3 days. I couldn't go to the pharmacy, I couldn't go anywhere because I was in pain. If they're not helping us, and then who can we trust?
The police say harsh tactics are needed in the townships.
If they don't listen, then unfortunately those things happen. I'm not saying it's right. And in some communities, that's all the members of the public understand. They need to see those things, unfortunately, before they adhere to instructions, yes. They need to see that this is serious and the police are not just telling you to go in the house because, it's a willy-nilly instruction.
Police are out in force in Kenya too. Here, they sometimes use tear gas to keep people inside. The capital, Nairobi, is under lockdown. No one is allowed to leave or enter the city, leaving some stranded. A student came back from abroad for the Easter break, but is now stuck in her 4th week of extended quarantine in a hotel. She said the government has offered hardly any support.
I am crying at this point in time because I want to go home. It's not like I'm saying that I won't self-isolate. I will.
Kenya's president told the nation tough measures were vital to stop the virus spreading.
I know, especially when we introduced the curfew, maybe in the initial stages there were some challenges, and I want to apologize to all Kenyans, maybe for some excesses that were conducted or happened.
In Madagascar, people set aside fear of catching the virus from each other when authorities briefly lifted a travel ban. But fear remained in control in Ivory Coast, where people in Abidjan destroyed a testing center being built in their neighborhood.
We are the people. We don't want the coronavirus here. This is right next to the people. We don't want it. We don't want it today, tomorrow. We don't want it the day after tomorrow. That's right. We don't want it.
Test, test, test is the World Health Organization's simple recipe for getting a grip on the pandemic. But in most countries, there are not enough test kits or laboratories to process the kits. South Africa leads the continent's testing drive. Officials have fired up the country's large health research and tracing facilities honed by years of fighting HIV. They're promoting independent testing amid reports that nurses are refusing to work in hospitals and testing centers due to a lack of protective gear.
Like most of the people, they can't do this. Actually, during training, it was like more of us, but then some, they just didn't want to come anymore. Actually, for me, yeah, I'm proud of myself for doing this, for the country. Yes, I'm a soldier, actually.
By the end of April, the South African National Health Laboratory Service has said it will be able to process about 36,000 tests a day. At the same time, the global race to produce a vaccination is on. Fears spread across the continent that Africans would be used as guinea pigs after 2 French doctors in a televised debate suggested that trials could be carried out in Africa. The Director General of the World Health Organization responded swiftly.
Africa cannot and will not be a testing ground for any vaccine. We will follow all the rules to test any vaccine or therapeutics all over the world using exactly the same rule. Whether it's in Europe, Africa, or wherever, we will use the same protocol, and if there is a need to be tested elsewhere, to treat human beings the same way, equally.
As a vaccine is still a long way off, Some are rushing to stock up on chloroquine, a cheap anti-malaria medication, after promising early signs that it might help fight COVID-19. In Burkina Faso, this Ouagadougou resident bought large stock just in case.
By the time we get the official approval for the product, it will already be available.
Small studies in France and China suggest it may reduce the virus load.
The patients under treatment, especially under specific treatment, such as hydroxychloroquine, recover faster, we have found. But I have to say, when it comes to science, observation alone is not enough, and extensive research is needed before a theory can be validated.
South Africa, Burkina Faso and Cameroon have authorized hospitals to use the drugs on coronavirus patients. But the World Health Organization says more tests need to be done, and it should also not be used at home. Several people have died of side effects after taking it without medical supervision. The biggest risk of contagion is in densely populated, poorer areas. Cape Town's Kailicha was the first South African township to confirm a COVID-19 case. It's nearly impossible in places like this to keep physical distance and maintain hygiene.
It's not easy. We try to stay in the shacks, but you can't. You have to go out, collect the water, come back. You don't have candles? You have to go buy them quickly and come back. That's how we survive in the shacks.
Yet hope and awareness are crucial too. And musicians across the continent, like Uganda's Bobi Wine, are producing catchy corona songs, offering even people living in shacks a little of both.
Discipline and personal hygiene, and make sure you regularly wash your hands. Keep a distance from everyone. Report anything like a symptom. Serious fever is a symptom. Dry cough is a symptom. Walkway tamula is a symptom. Itchy eyes and flu is a symptom. News is that everyone is a potential victim, but the good news is that everyone is a potential solution. Coronavirus is sweeping over mankind. Everybody must be alive.